Hi, and welcome to Chapter 13, Patient Assessment. Throughout this chapter, we're going to talk a lot about assessment and vital signs and EKGs and how you do those in the role of a radiographer. So one of the abilities to perform basic patient assessment is essential for our role as a radiographer. We want to be able to go in, put the patient at ease, get the exam done without any repeats, and limit how much time that person has to be in our department. I have a short video for you to watch. I only want you to watch the first 4 minutes. It is a nursing video, but it does a nice job of explaining what you should be doing when you are first entering the room with a patient. So I really want you to stop and think about, if I'm going to do a portable on this person in their hospital room, this is how I should greet my patient. If I'm picking them up and they're an inpatient in the waiting area, this is what I should do with this particular patient. So they're going to go through and they're going to identify these tools. And they're going to ask some questions of the patient. So pay particularly close attention to that part in the video, because one of the problems our students have identified when they go out is that they really don't know how to talk to a patient. So they do give you some ideas of things that you should be asking and identifying with your patient when you meet with them. So some of the questions that you can ask is, how did this happen? When did this first start to trouble you? And has it been becoming worse? Does it bother you all the time? Where does it hurt? Can you point at where it hurts the most? What does that feel like? How severe is it? Is it keeping you up at night? And is it something that seems to make it worse? Is this something that happened recently? Is it something that happened in the past? Sometimes you want to ask them as well, is there a particular position that helps to alleviate that pain? So that when you have them on the x-ray table, if they tell you that by bending their knees that might be more comfortable, then you should accommodate for that. Or maybe you need to do the exam very quickly and then have them sit up so that they're not resting on their back during the exam. So try to think of things that you can ask them when we are practicing in lab, and so that you get used to and comfortable with those types of questions for your patient. We do take vital signs in certain areas. So in the main department, probably not as much, but if you are working in a doctor's office, orthopedic office, urgent care, sometimes your role as a radiographer is also to bring a patient back into the room and check them in. So when I worked at those locations, that was part of my role. I would go and I'd greet them in the waiting area, bring them back, and I would do some vital signs on them, and then I would let the physician know that they could go in to see the patient. So I did vital signs all the time. That was part of my job. And then when I wasn't doing that, I was doing the x-rays. So sometimes you have dual roles in those facilities. So it is important to know what to look for vital signs. I have some really nice videos that I'm going to have you watch on that do an excellent job of showing you what to do in that role. And we're also going to practice in lab so that you know what to do in real life with the tools that are provided for you. There are some standardized color code medical alert wristbands that you should be looking for when your patient comes into the department. If they have on their chart or on them a badge that says DNR, that means do not resuscitate. That means if that patient codes on the table, you should not call the code team in. They do not wish to be revived. You also need to look for allergies, so sometimes they'll identify those on the patient, or they will have that in the chart as well, and then if it's a fall risk, it'll be documented. One of the things I want you to get used to when you're looking at your patient is start to assess how they look. So what's their skin color? What's their level of consciousness? Were they really alert when they came in the room, but then 15 minutes into the exam, they're no longer alert, they're slurring their words, maybe their breathing has changed. These are all indications that maybe something else is going on with your patient that you need to be aware of. The other thing that's common for us to do is to take a look at laboratory results. So before you bring a patient in, especially for IVUs, one of the things that we have to do is look at their blood counts, so their CBC counts, and other other items that we may need to be aware of. So if they've had a glucose test, then they've had a test that's done for the blood sugar. And if they've had a cholesterol test, it's for heart disease. That bun creatine levels, what are those? And here's an example. So serum creatine levels in an adult should be 0.6 to 1.3 milligrams. This is for kidney function. So your creatine is a waste product of your blood, and it normally is removed by the kidneys, but if the kidneys aren't functioning properly, then these levels are not going to be accurate, and we really shouldn't be doing the IVU. Same with your bun levels, which is your blood urea nitrogen. So typically this is the range, and it's measuring a normal range, then we're fine. We can continue with our exams, but if these numbers are off, then your kidneys or liver might not be working properly, and we need to hold off on doing that exam as well. So one of the things that we're going to take a look at in those videos that I've posted is how to take those vital signs and what to look for mental state of pain. And so I want you to take a few minutes, take a look at those videos. She does a very nice job of explaining them, identifying what the normal signs are for those vital signs. I've also given you some key terms that you need to be aware of, like pyrexia or hypothermia, and how to define those. Make sure you know your routes of measurement. For us, we typically will do oral for our measurements for the route, or we're going to do temporal. So we have, just like when you go into the hospitals and they're waving that thermometer in front of your forehead and doing a reading, that's what we would do in the department. So we're going to practice doing those down in lab. Same with the pulse rate. We're going to measure each other's pulses to make sure that we're taking those correctly on one another and that we can identify them. One of the things that I do want to point out for us, the radial pulse is typically what we're going to read, and that's what we're going to concentrate on in lab. And when you are doing your pulse, sometimes we'll do the apical pulse with the stethoscope, but typically, again, we're going to grab onto their wrist and we're going to place our two fingers, our index and middle finger, by the base of the thumb, and we're going to look for that radial artery when we're doing our readings. So there are other areas that you can identify for taking pulse, but typically those are not ones that we're going to be looking for as a radiographer, but you do still need to be familiar with where they're at. So one of the things that I'm going to remind you, don't press too hard because you're going to end up reading your pulse instead, and the same thing with using your thumb. You're going to end up taking your pulse and not theirs. We will practice using the pulse ox when we get into lab. With pulse ox, we're looking for how much oxygen saturation is taking place in that patient, and do they need to be put on oxygen. And we're also going to take respirations when we're down in lab. So the one thing with respirations is when you're watching the patient, just make sure that they don't know that you're watching, because then they'll overemphasize their breaths for you. So we want to make sure that they are taking normal breaths and counting those normal breaths during respirations. So we are going to take blood pressure readings in lab as well. So I'm going to show you how to put that blood pressure on. We're going to look for that systolic pressure, which is the highest number, and your diastolic pressure, which is your lowest number. And typically we should be 120/80 when we're doing those readings. So we'll learn how to do those. Mental alertness is something, again, that you're going to monitor with your patient, and you may have a patient measurement scale where you're going to point to how bad is your pain. We do deal a lot with oxygen administration, so I do have a video for you to watch on that as well. And just remember that a device that looks like this, that says green oxygen, these are your flow meters. These will be located in each of those x-ray rooms, so radiography rooms, and just be aware your patients may come down with transport and have oxygen tanks on the back of their wheelchairs. You may have a patient who comes in with an oxygen tank that they are on at 24/7, so they go home and they still have oxygen at home, so like your COPD patients. And then when you're stretchers, they will also transport oxygen in your stretcher, so be aware of watching for lines when you're moving them onto the x-ray table. EKGs are mentioned in the last of the chapter. So just know that the only time I did an EKG was when I was at an urgent care. That was part of my job duty. You literally have a diagram that's right in front of you, and you match those leads on your patient with the diagram. So it does a nice job of showing you exactly where to place it with that. So when we're taking an EKG, I do have a video for you to watch that does a nice job of showing you how to put those leads on, and then it shows you how to read the strip when it comes out. We don't typically read the strips. Those are the radiologist that's going to read, but we do need to know that there is a P that goes through the U, and what this means is you have your PR interval, and then you have a QRS complex those are where it starts to rise, and then it comes off the T and U, and then that whole process starts again. So we can break down the heart when it's contracting and pumping and how it takes those readings, but when we're looking at this sheet, we need to be able to go, okay, I have enough for the doctor to do a reading, and so they're going to have enough information to diagnose the patient to make sure that there's no irregular heartbeats. I did give you a picture of how a pacemaker is placed in. So you will have patients that have pacemakers, and these are electrodes that are placed into the heart. And so just be aware that you may have a person who comes into the department that has a pacemaker. There's nothing that you need to do as a radiographer in that situation. They've just already been identified with that EKG that they have an irregular heartbeat. So they are trying to correct that with the pacemakers, is what you need to be aware of. All right, so take a look at those videos, and that's going to show you how to do a lot of those routines, and then we're going to practice when we get into lab. So I will see you when you come to lab for these. Have a great rest of your week.